A very good evening. From stories around the world to stories here at home, this is the National News Broadcast. I'm Vidushni Satish Kumar.
And I'm Tarak Etiaraji. First to look at the stories making the headlines this evening.
Former Minister Ishod Bertillon appears before the Criminal Investigation Department. The tally of recovered COVID-19 patients in the country has escalated to 68. Sri Lanka Podujana Peramuna says that the present crisis situation in the country was controlled through a correct political leadership. Commemorative events to mark the Easter Sunday attacks to be held without the participation of the public, says His Eminence Malcolm Cardinal Ranjit. Special loan program with concessionary interest rates for 36 crop varieties.
In your local stories this evening, former Minister Ishod Bertillon appeared before the Criminal Investigation Department today to record a statement related to an investigation over a property deal. The former minister has been alleged over an illegal land deal carried out in Mana area. Accordingly, another statement was recorded from the former minister on April 14th by the CID. Former Minister Ishod Bertillon was summoned to the department today for further investigations of the incident. The Criminal Investigation Department has disclosed that Riaz Bertillon, younger brother of former Minister Ishod Bertillon, had maintained direct contacts with one of the bombers of the series of Easter Sunday attacks. This was revealed after commencement of complex inquiries in a new format. Nearly 260 persons were killed in a suicide bomb attack conducted in 7 locations, including the churches in Kochikade and Katuwapitia on the 21st of April 2019. According to information received, such attacks had been launched even after 97 warnings by the intelligence regarding such attacks on the then government. Many accusations from several parties were levelled, claiming that the investigations were carried out in a biased manner. Thereafter, the CID, the Terrorist Inquiry Division, and the Intelligence Divisions have jointly conducted investigations in a new manner under the instructions of President Gotabaya Rajapaksa. As a result, brother of Ishod Bertillon Mohammad Riaz was arrested in Puttalam yesterday along with 5 other suspects.
The Management Committee for the COVID-19 Healthcare and Social Security Fund was convened yesterday. Future measures to achieve the objectives aspired by President Gotabaya Rajapaksa when establishing the fund were discussed during the meeting. Governor of the Central Bank of Sri Lanka, Professor W.D. Lakshman, has been appointed as the chairman of the committee, while Chief Financial Officer of the President's Office, Ravindra G. Vimalavira, has been appointed as the secretary. The committee is comprised of Secretary to the Finance Ministry, S.R. Artigala, Defence Secretary, Retired Major General Kamal Gunaratna, Secretary to the Ministry of Public Administration, S. Tiarachi, Health Secretary, Badrani Javadana, Acting IGP C.D. Vikramaratna, Director General of the Health Services, Dr. Anil Jasinga, Director General of Sri Lanka Customs, Retired Major General Vijita Ravipriya, Chairman of SATOSA, Nushad M. Pereira, Chairman of the Employees Trust Fund Board, Sriyananda Silva Vijayaratna, Additional Secretary to the Presidential Secretariat, P.D. Indika L. Gunawardana, Director General of Presidential Secretariat, Attorney at Law, Harigupta Rohanadira, Assistant Governor of the Central Bank of Sri Lanka, NWGRD Nanayakara, Senior Deputy General Manager of Bank of Ceylon, WP Russell Fonseca, former Auditor General S. Swarna Jyoti, and former Chairman of the Colombo High Court Lawyers Association, Attorney at Law, JMSG Jayasundara. Donations directed to the fund will be utilized to facilitate provision of medicine, medical research equipment, providing financial needs for health security facilities, including capacity building to prevent the spread of the coronavirus. Funds will be also allocated to ensure the safety and well-being of employees of the health sector and essential service providers. Provisions for basic needs of children, women, low-income earning families, senior citizens, disabled persons, and other vulnerable groups are also among the main objectives of the fund. Allocations of necessary provisions to link public health, rural and distant medical centers, research and treatment centers, and health service systems to reduce the spread of communicable diseases will be facilitated through the fund. Assisting innovation of health and sanitary products, domestic resources, knowledge and local medical sectors will also be a responsibility of the fund. Promotion of the supply of protective gear and sanitary products developed with the use of local medical and scientific knowledge and experience to the global markets will be facilitated through the fund. Another objective of the fund will be to facilitate the promotion of lifestyles with traditional values, a healthy life and the consumption of carbonic food through media and educational programs. The fund is also tasked with the responsibility of coordination with the WHO, UNICEF, UNDP, the World Bank, Asian Development Bank and major development donor communities and agencies to raise funds. The Chief Administrator of the Gangarama Temple, Venerable Dr. Kirinde Asajithera, has donated 10 million rupees from the Gangarama Vesak Fund to President Gotabaya Rajapaksa for the COVID-19 Healthcare and Social Fund. Meanwhile, Venerable Dr. Malwane Chandraratana handed over a donation of 2.5 million rupees collected by the Teachers Association of the University of Kelaniya to the President. Donations of 2.5 million rupees were handed over to the National Water Supply and Drainage Board Engineers Association to the fund. Also, 1 million rupees worth contribution was made by Mr. S.D. Amarasinghe to the fund as well. Huawei Technologies Lanka Co. Private Limited also made a donation of 1.5 million rupees. All donations can be credited to the special account opened under the number 857-373-73 at the corporate branch of the Bank of Ceylon.
His Eminence Malcolm Cardinal Ranjit says that necessary plans are in place to conduct all commemoration events to mark the first anniversary of the tragic Easter Sunday bombings through electronic media without public gatherings. The Archbishop explained on the plan to conduct these programs during a media briefing held today. His Eminence Malcolm Cardinal Ranjit said that they have decided to cancel all commemorative events planned to be held in the memory of those who lost their lives from the bomb attacks carried out in St. Anthony's Church, Kochikade and St. Sebastian Church, Katuwapitia. He requested the support of all media institutions to broadcast the commemoration program through the electronic medium to avoid any public gatherings. He also requested all Catholic churches to ring respective church bells at 8:40 a.m. on April 21st. He further requested other religious establishments in the country to join this commemorative event. His Eminence requested all to observe a 2-minute silence at 8:45 a.m. and light a lamp or a candle in the remembrance of those who lost their lives from the attack. His Eminence also made remarks over the investigations carried out regarding the Easter Sunday attack. His Eminence Malcolm Cardinal Ranjit said that he is thankful to the President, Prime Minister and the government for strengthening the relevant investigation process. He said that a conspiracy was in place to create religious rebellions and to sabotage the prevailing religious unity in the country. His Eminence emphasized that the revealing of the responsible persons and the truth without any discrimination would be considered as fulfilling justice for the victims of the attacks. His Eminence also made remarks over the quarantine programs carried out in against the coronavirus epidemic. His Eminence Malcolm Cardinal Ranjit requested the President to continue the quarantine process in the country. He also said that irresponsible persons are still at large while endangering the others. He said that if an individual has symptoms for the disease, then they should consult the medical authorities accordingly.
Heads of foreign missions in Sri Lanka have extended their appreciation over the progress achieved by the Sri Lankan government and the people over the prevention of the spread of the coronavirus in the country. They have pledged to extend their assistance to Sri Lanka for the eradication of the disease. These remarks were made during a meeting held between the Presidential Task Force for Essential Services and the heads of the foreign missions in Sri Lanka today. The meeting was held under the patronage of the head of the Presidential Task Force, Basil Rajapaksa. Ambassadors and High Commissioners representing many countries, including the United States of America, Britain, Australia and Canada, were present for the meeting.
Well, the tally of recovered COVID-19 patients in the country has escalated to 68 after 5 patients were discharged from hospitals in the last 24 hours following their recovery from the disease today. Meanwhile, the total confirmed cases of COVID-19 infections in the country was increased to 238 yesterday. 4 out of the 5 COVID-19 patients whom were reported yesterday were identified from quarantine centres. One of the patients was a 15-year-old female currently being quarantined at Kandakadu Quarantine Centre. The mother and the brother of the patients are also receiving treatments at Valikanda Base Hospital at present, and another patient, 28-year-old female, was identified from Puttalam area who was directed to the Katukalia Quarantine Centre. Another 2 patients were recorded from Palali Quarantine Centre. One of the patients was identified as 60-year-old male, while the other patient was a 61-year-old female. They had participated in a religious program conducted by a person who had visited the country from Switzerland. Director General of Health Services Dr. Anil Jasinger said that a COVID-19 patient, a 59-year-old resident from Kotahena, was reported from the Colombo General Hospital for the first time in 5 days. She was directed to the IDH hospital. Apart from the recovered patients, another 163 COVID-19 patients are still receiving treatments for the disease. They are currently admitted to IDH, Valikanda Base Hospital, Colombo East Based Hospital and Iranavilla Hospital. 7 patients have died from the disease thus far, while 161 persons are under medical observations for COVID-19. Majority of the COVID-19 patients were reported from Colombo district with a total of 49 patients. 45 patients have been reported from Kaluthara district, while 35 patients were recorded from Puttalam district. Gampha district has reported 28 patients. Meanwhile, Nagalam Street close to Grand Pass and Thotalanga areas in Colombo was declared as an isolated area from this morning. 2 persons apprehended by the Sri Lankan Navy in Jayala, Suduvalla was identified to be COVID-19 patients after they were directed to a quarantine centre recently. Reports have indicated that one of the patients had visited the Nagalam Street in Colombo. Accordingly, 100 residents in the area were directed to Sampur Quarantine Centre yesterday. Sri Lanka Army Commander Lieutenant General Shavendra Silva said that the area has been declared as an isolated area due to the uncertainties raised in missing out on any person from the area. Meanwhile, biotissues from 65 persons who had closely associated with COVID-19 patients identified from Beruwala, Pannila and Chinakotua areas were obtained today. A group of 11 persons left the Busa Sri Lanka Navy Quarantine Centre after completing the quarantine period. They were directed to a PCR test prior to their departure from the centre. They will receive the certificate for successfully completing the quarantine period after receiving the PCR test results. Another group of 20 persons left the Panichan Karni Sri Lanka Army Quarantine Centre today. They were directed to the centre from Dehiwala and the Chilau areas. Sri Lanka Army Commander Lieutenant General Shavendra Silva said that 1,631 persons are currently being quarantined at quarantine centres and 3,721 persons have left the quarantine centres after completing the quarantine process. 20,000 test kits to identify coronavirus-based diseases have been donated to Sri Lanka jointly by the foundation of Jack Ma, the founder of Alibaba Group of Companies, and Alibaba Foundation. The test kits worth $129,000 were handed over to Prime Minister Mahinda Rajapaksa by the representatives of the foundations. Many projects carried out at the Neville Fernando Hospital with the assistance of the Sri Lankan Navy, including a building to admit patients and test outdoor cultures and a camera system to provide treatments while maintaining social distancing, were officially handed over to the hospital yesterday. The projects were carried under the direct observation of Sri Lanka Army Commander Vice Admiral Pial De Silva. Meanwhile, Sea Lion Holdings Company has taken steps to hand over the Ruvala Resort to Sri Lankan Navy to hold persons directed for the quarantine process. Sri Lankan Navy Commander Vice Admiral Pial De Silva and Executive President of the company, Captain Ajit Piris, were also present at this occasion.
to support the President and the Sri Lankan government, the armed forces and the medical fraternity to eradicate the COVID-19 pandemic from our country, Sri Lanka.
The decision to reopen the airport and repatriation of Sri Lankans abroad will be reached upon the recommendations made by the Presidential Task Force appointed by the President to prevent the spread of COVID-19 epidemic. Minister Prasanna Ranasinghe said that the persons expected to arrive from abroad have been listed through the respective foreign missions. He said that opportunity to bring them back into the country will be facilitated with the assistance of the Sri Lankan Airlines and affiliated institutions after reopening the airports.
We have a special announcement. The government has announced that the strategy to rebuild the economy after ensuring the daily life of the people are back to normalcy, which was hindered due to the coronavirus epidemic, will be announced this weekend. The curfew reimposed at 4 p.m. today for 19 districts will be effective until the April 20th morning. Steps have been taken to continue the curfew imposed in high-risk zones until further notice. The districts of Colombo, Gampaha, Kalutara, Puttalam, Kandy and Jaffna have been identified as high-risk zones for the spread of the coronavirus. Meanwhile, the remaining districts, the curfew was lifted at 6 a.m. today and reimposed at 4 p.m. on the same day. The imposed curfew will be in effect until Monday, April 20th at 6 a.m. The curfew was relaxed for the first time since the Sinhala and Tamil New Year. The government informed the general public today to continuously follow health precautions and to maintain social distancing when especially purchasing essential items. Accordingly, many had flocked into cities to purchase essential commodities. Most of the public adhered to the health instructions while engaging in purchasing activities today. The government decided to impose the island-wide curfew to maintain social distancing with the aim to prevent the spread of the coronavirus. The government has requested the public to bear the inconveniences caused due to the enforced curfews in a responsible manner. The government has also requested the public to limit the purchasing activities only to purchase essential commodities without hoarding and refrain from engaging in unnecessary movements. Defence force sectors have pointed out that stern legal action will be taken against the offenders who misappropriate mechanisms in place to maintain the essential services during curfew hours efficiently. 1,599 persons have been taken into custody for violating the curfew orders during the past 24 hours until 6 a.m. today. The police have taken 383 vehicles into custody. The police have said that police patrols and roadblocks would be continued in order to arrest curfew violators.
Sri Lanka Podujana Peramuna says that a significant process has been achieved in controlling the spread of the coronavirus as a result of the government led by the President directed the state mechanism in an efficient and the correct manner. The representatives of the party have pointed out that the nation would have faced an immense calamity if the previous government was in power under the prevailing circumstances. The leadership provided by the President Gotabaya Rajapaksa to overcome the COVID-19 disease expansion has been highly acclaimed by the international standards. According to latest gradings on the issue by the renowned ICMA Institute of Australia, President Gotabaya Rajapaksa is among the 9 state leaders who have more effectively confronted the COVID pandemic. The ICMA COVID Index further points out that powerful world leaders Donald Trump, Vladimir Putin, Xi Jinping and Boris Johnson lags behind the Sri Lankan head of state in this connection. The ICMA has taken into consideration in preparing the index on leadership ability and efficiency as well as preparedness of health divisions of the respective countries in facing the COVID-19 infection. Dr. Chris De Souza, who has devised the index identified by the abbreviations GRID, says that world leaders with broad vision extending beyond national boundaries formulate to build global partnership on common welfare on the entire world community. Dr. De Souza further points out that such leaders are dedicated to safeguard and nurture their countrymen in a time of a crisis. Former parliamentarian Lakshman Yapa Abeyewardena said that the entire nation is aware on the President's governance, the Prime Minister's direction and the commitment extended by the head of the Special Presidential Task Force, Basil Rajapaksa, appointed by the President to normalise and continue the state mechanism. He extended his gratitude to the health sector triforces, state mechanism and administrative mechanism and the civil societies for taking over the duties and rendering their assistance for this task under the guidance of the political leadership.
Medical specialists have said that the country's health and hospital system has extended their fullest efforts in providing necessary services for all pregnant women. A special 24-hour operated telephone number has been introduced to resolve the issues pertaining to pregnant women. The relevant clinics have been carried out in the field as well as in hospitals accordingly. Medical specialists have indicated that the government has permitted to use the clinic card as curfew passes to attend the clinics. Meanwhile, a special 24-hour operated telephone number has been introduced to resolve issues pertaining to pregnant mothers. Association of Obstetricians and Gynecologists of Sri Lanka has said that the pregnant women could be part of the program through the telephone number 071 0301 225. Medical specialists have said that house calls and clinical services expected to be provided for pregnant women through the program. They said that acquiring these services is essential in accordance to the instructions given to them. They have requested that pregnant women to maintain close relations with the family health officers. They have also said that relevant clinics have been carried out in the field as well as in hospitals and they can make appointments accordingly. They have also said that pregnant mothers should not fear over the present situation as relevant services are being carried out without any hindrances. They have also pointed out that the rare possibility in transmitting the COVID-19 infection from mother to child, especially when breastfeeding. That's all the news we have for you tonight. The national news broadcast will return tomorrow, and until then, a very good night to you all.
Good night.